We've got Dr. Amber Voitenko back here with us today for a longer piece to kind of take a deeper dive into some of the things that she does with chiropractic adjustment as well as other things. So Dr. Amber has, as she likes to be called, she's been in practice for 20 years as a chiropractor, and she specializes in sprains, strains, pain management, autoimmune disorders, and hormone imbalances. And as I stated in her last interview, many times people who get into an area that they're super passionate about is because they needed help in that area. And Dr. Amber had a neck injury at 14, and that is kind of what thrust her into chiropractic care. So let's have your wisdom soak into us.
Okay, awesome. Thank you for having me, Amy. I'm so happy to be here. Yeah, it's amazing when certain incidences in your life, create this purpose, so this purposeful life is what ended up happening to me. My neck injury led to this whole world of wellness and health, and chiropractic's amazing. It saved my life. So
yeah, awesome.
I'm glad to be here talking about chiropractic and how it helps with everything pelvis, all the things pelvis. So,
right.
I guess where I'll start is chiropractic. When people think of chiropractic, they think obviously of pain, joint pain, osteoarthritis, that kind of situation, sprain strains like car accidents, things like that. But really what we study in chiropractic is the techniques to help the structural component of the body, because we're helping the nervous system. Your nervous system controls every muscle, organ, gland, and tissue. So basically, when it comes to the pelvis region, the low back and pelvis, the nervous system in that area control your bladder, your reproductive organs, the pelvic wall, everything from your hips, knees, ankles, feet down.
Yeah.
It's the whole foundation of your body, actually.
Yeah.
So we help with that. Yeah, here at the clinic. My clinic's name, by the way, is Voitenko Wellness and Chiropractic Services. So we really specialize in helping individuals with those symptoms and what they come in with. So being that we're talking about this today, some of the symptoms that individuals, are you okay if I go in with symptoms, Amy?
Absolutely.
Cool. So a lot of the things that walk in, my 20 years of clinical experience that walk in the office have to do with bladder problems like incontinence, believe it or not, even pooping their pants. Sexual intercourse is painful, yeast infections, bladder infections, and then getting into some of the hormonal issues, PMS, cysts on their ovaries, fibroids of the uterus. That's actually in the last probably 3 years have come into my practice a lot, along with polycystic ovary disease. So, and those conditions have many different symptoms that occur. But what I think I'll start with, because it's very important to understand, like, your nervous system, because it controls those glands, tissues, and cells and muscles. When you have subluxation, misalignment, getting chiropractic treatment really can help the function of those nerves to help with the cells, the glands, and the organs in that area.
Right.
So very, very effective getting chiropractic adjustment. And Amy and I were talking, it's funny, when I talk about chiropractic, I'm so passionate about it, but, I'm talking about adjustments, and there are many different techniques. I mean, there's over 100 different techniques in chiropractic. The specialty that I do, though, is we do a lot of activator, a lot of blocking, especially when it comes to the low back, pelvis. We do Thompson drop, and it's very gentle, specific adjustments that, when you have subluxation, create this environment that helps the body, helps better function. So women have less PMS symptoms. So cramping, headaches, fatigue, those issues really over a certain period of time, which can take a chiropractor with a young woman, very short period of time, maybe, people think, oh, once you go to a chiropractor, you always have to go. But really, when it comes to what I do. When they're younger and they're having PMS, you can handle that situation within a month's, 2 months time, and give them the tools they need at home so they're not, you know, running into those symptoms. And a lot of my young patients that come in, women, you know, they're out of school because they have headaches or cramps or the bleeding, you know, they can't go anywhere. So it really puts a damper on their sports activities, their school. So
have you found, you know, in your 20 years, have you found that women are having more problems with, you know, like female reproduction or just the woman's pelvis in general? Have you found that they're getting more problems?
yes,
Because I feel like they are.
I agree with you.
But you have a lot more experience than I do, so.
Yeah, well, no, I definitely agree with you. And you're seeing what I'm seeing. I mean, when I graduated, you know, I would talk to women about their symptoms and their histories more over the last probably 10 years, more polycystic ovary disease, cysts on the ovaries, and fibroids. And I feel the reason for that, because my nutrition side, my wellness side, you know, our food, Amy, is so depleted. Like after World War II, we started turning our soils, so the vitamins and minerals started to become less and less. And then in 1994, you know, our country went all genetic modified organisms. So we don't really know the value of nutrition in our foods.
Right.
But yeah, it's definitely gone up. And again, I attribute it to having deficiencies. That's why we, like here at the clinic, we have hormonal testing we do. Very specific. It's a saliva spit test. It's very, very affordable in my mind. Unfortunately, insurance doesn't cover it, but the data and the amount of information you get is huge because it talks about your values, your levels of estrogen, progesterone, testosterone. The spit test can also evaluate the adrenal glands, which have a lot to do with whether or not your immune system is functioning correctly. And so saliva testing, by the way, is the gold standard for hormonal testing, like even over blood.
Wow.
So very important, you know, and those tests are, again, you know, too, because it's always, people always want to know, well, where to get these tests. You know, a lot of chiropractors that are holistic can, you know, prescribe this test kit. And I have helped many women balance hormones, their progesterone, estrogen levels, even testosterone levels.
And what I have found too, just in my own, health journey, you have, as a patient, you have to be very specific. So I wanted a huge full blood workup.
Yeah.
And I had, you know, my naturopath write down every single test she wanted me to take. And there were like 6 thyroid tests. Well, I didn't even know there were 6 thyroid tests. And the clinic that, I mean, your mainstream medical doctor generally tests TSH, T3, T4, but there are other factors. And also, doesn't the thyroid, it fluctuates kind of all day. So if you test it in the morning, then you test in the afternoon, test in the evening, it may be very different.
Yes.
Is that true? Because that's what I have been told.
Yes, it is true. And the interesting thing is with the thyroid is, you know, holistically, when we study the thyroid is a very complicated animal, but really when you get the proper testing, like you're talking about, there's 3 pathways where we can identify, you know, is it autoimmune? Is it truly the fact that the gland itself isn't doing its job? You know, so, and what's so exciting about that, when you get thorough testing, like you're talking about, it's like your map, and you can actually help people naturally so that they can avoid, you know, having a lifetime of these symptoms and avoid a lifetime of even medication. Right. So of course, you know, and I'm here to say as a doctor of chiropractic, I mean, there's a time and place for medication, of course, but absolutely, you know, if you can get to something and really thoroughly look at it, and it is true, you know, when you go to your medical doctor, unfortunately, there's parameters because, of course, a lot of them are basing their medicine off of insurance, you know, because that's kind of how the system goes here, you know. So you really, like you did, you have to dig and say, okay, what are all the tests that, you know, they would want you to do to have a very good picture on what's going on with the body. Very important. And a lot of, I have even a sheet, Amy. It's funny you talked about that with your naturopath, because here at our office, patients come in and they're like, well, Dr. Amber, what would you ask for if you went in? And I have a whole sheet written up. And of course, a lot of us doctors of chiropractic, we have access. Like I'm with a co-op, so it's very inexpensive. Of course, it's still cash out of pocket, but it's inexpensive to get those, specific tests.
Right.
So they're out there for you. And one thing I'll just end with that is I want to make sure everyone knows saliva testing, though, is the gold standard.
Yeah.
And, that's important to understand for the estrogen, progesterone, testosterone. Like in it, Dr. John Lee, he was like the leading MD in natural approaches to helping women with hormonal balance. He's passed now. He was amazing. He's got many books that you can go out and read that really talk about balancing hormones, and it's in really easy, I don't want to say layman terms per se, but it's easy to follow.
Sure.
And if I could impart anything, which I talk to my patients about, like if you want to read more about that, he's got books and books.
Yeah.
Speaking
of books, I actually just picked up Woman Code.
Oh yes, I haven't read that.
I mean, it's incredible. And I'm only like half a chapter in, and I'm like, what? Because that book is all about like basically eating to your endocrine system to balance your hormones. So,
yes.
But what I think I just want to impart on people is this isn't common knowledge. So some people, they're like, well, how do I even know what to ask? I mean, I'm 40. I've been in the medical field since I was 17. I've been a nurse for 8 years. And I literally just found out less than a year ago that there are more than 3 or 4 thyroid tests. So don't get down on yourself. Now you know. So when you know better, you do better. That's all there is. So do not judge yourself. Just,
Yes.
Answers. So yeah, that's all I want to
the
say.
same way. Just more education. Well, knowledge is power in the sense of taking control of your health. And of course, we can't all be experts in every facet of life. That's why we have each other and we learn from each other, right? So yeah. I want to say this just really quick, because I know we got off onto hormone balancing and all that. Well, that's what we're talking about here, but with the thyroid, there is an amazing test, and you probably heard of it. Women actually do it to see when they're ovulating. It's called Barnes test.
Yeah.
And it's this simple temperature test when you wake up in the morning and you take your temperature before you get a drink of water or go to the bathroom or go eat breakfast, whatever. You take your temperature and you write it down. And if you do it 3 days in a row or 5 days in a row, you'll get an average temperature, right? And 97.6 is that's like on the fence. You want to be a little bit higher than that. But the reason I'm telling you this is because if you're questioning, well, gosh, I feel like I have a thyroid problem, right? And thyroid problems really lead to lots of mood swings, up and down emotions, I'm not saying bipolar doesn't exist, because of course it's a diagnosis, but a lot of times thyroid's missed, and women, feel like, oh my gosh, why am I feeling this way? Why do I feel nuts?
Exactly. I'm going crazy.
Yeah. And their thyroid's been missed even, and they haven't even yet been diagnosed with a thyroid issue. So that Barnes test, you guys can look it up. You can find it online too, but of course I can give you data on it. But wow, what a great way to see if your thyroid's sluggish. Like even if it's coming up on blood, because a lot of times it's missed on blood, even with the very extensive panels, right?
Yeah.
So yeah.
And I've never had a spit hormone test done. All my testing has been blood.
Right.
And my naturopath did not suggest I do spit either. So that's interesting.
Right. Yeah. Yeah. Very interesting. And this, just to clarify too, the spit test is more for estrogen, progesterone, testosterone, and your adrenal glands.
Right. Okay.
Thyroid really is very specific. And like you can do Barnes test and you can map it with the temperature test, and then with doing the blood test. But if I can say anything, this is my clinical experience and my clinical suggestion. It's like, if you feel like you have thyroid issues, right? Because that also affects everything we're talking about with your reproductive organs. The whole thing's connected. So if you feel like you have those, you've got to really dive in and be patient, but address it, start looking to the thyroid, very, very important.
Right.
And doing the natural things. And we can have a whole conversation about that.
Yeah.
I would like to talk a little bit, because like I was telling you guys earlier, fibroids have come in a lot, women with uterine fibroids, and so uncomfortable for women, you guys. They feel pregnant, they feel bloated, they feel gassy, they're having bowel issues, because when you have fibroids, it's an inflammatory response. So those fibroids within the uterus, they can be in the uterus, which makes the uterus very large, which pushes on the other organs and glands in your pelvis area.
Mm-hmm.
So going to the bathroom's an issue, whether it's bladder or bowel. So why I bring that up is, women will come in and they're like, I can't go to the bathroom. When I go to the bathroom, it hurts. So I have to help them rule out, what's going on. And anyway, many times, and I'm a doctor of chiropractic, but I've had to send them back to the gynecologist and have them discuss it, and they end up getting an ultrasound. But understanding fibroids are an iodine deficiency. Okay, very important. Yes.
Yeah.
It's also
Thank
an
you for
inflammatory
saying that.
response. So, yes. And it's also an inflammatory response. So, diet has a lot to do with it. When we are eating, if we're eating a lot of breads, pastas, rices, like too much in a day, that your body can't burn those sugars turn to inflammation, and inflammation can cause that problem to be worse, as well as the cysts on the ovaries.
Right.
And also another thing to bring up, so that's inflammation aspect of fibroids and cysts, but also polycystic ovary disease, is estrogens. We're in an estrogen environment. There's many things that we put on our bodies, especially us ladies, with makeups and creams that have estrogens. The meats we eat, if you're a meat eater, if you're not getting meats with no hormones, you're eating more estrogen. Right. That's going to create fibroids, polycystic ovary, those conditions to be worse. So you really, and I always tell people, because they get nervous, do I have to spend $1 million when I go to the grocery store? I don't want to, and I get it, that's why they joke about Whole Foods being a whole paycheck. But nowadays you can go to Ralph's, Albertsons, Stater Brothers, and you can get meats with no hormones. And, hopefully just letting even with the carbohydrates, if you really balance your diet, you will have less symptoms, especially with the fibroids.
Mm-hmm.
The other thing that I know no one wants to hear this either, but it's so important when you have fibroids, alcohol and caffeine really drive that problem.
Right.
And fibroids are uncomfortable. I mean, I've treated, and again, chiropractically, we help with the neurological part of it too, with the adjustments, but it also comes down to educating, like we're talking about. Some people might not realize that caffeine, alcohol, and estrogens that are in your meats, they're like, what? Really have a huge part in these pelvic region conditions. Yeah. So fibroids. And I do want to say this. I know that, when you're having heavy bleeding and you're bleeding out because you have fibroids, I mean, I've had women come in and they talk about it. I mean, they have to wear pads or changing their tampon every 15, 20 minutes. They're bringing changes of clothes to work, right? Because they're bleeding everywhere. And so the problem is they say, okay, well, what do I do in modern medicine right now? They talk about partial hysterectomies, which I think is a better choice personally. I'm just saying, if it was me personally, that's what I would choose if I was going to that route. But I want to tell you, when you go through menopause, if you can get to that point, these fibroids shrink. They do. Yeah. There is light at the end of the tunnel. Just, to put that out there.
Yeah. And I also do want to say that if a man got a period and was bleeding through his clothes, this shit would be fixed.
Yeah.
Cures for all of it. We have chewable Viagra.
Right.
Do you know how big Viagra is? And we need to chew it? Come on, guys.
I know.
So anyways, yeah, we're not going to go there. But
since we're going down that road in this sense of, I don't know, I just want to say this because it's so important. Women, when they come in, I make it very comfortable for them to talk about intercourse with their symptoms, and fibroids and cysts talk about pain.
Yeah.
I'm very good at my examination with nerves, the neurological component of my examination, the orthopedic component. And the reason I say that is because then I can identify, is this your big spinal nerves? Is this subluxation only? And that's why I've helped so many women, because I end up going, you got to go and get an ultrasound. I think that you have a cyst on your ovary or fibroids or some things going on in that region, you know? So
Right.
anyway, and people are embarrassed to talk about that. And a lot of
Oh,
times,
yeah.
yeah.
And that is the exact reason why I'm starting this podcast and why I just refuse to be silenced. You know, I mean, I sat in a group of OBs and their support team. I think there were 6 OBs in there. 2 were men. And man, this one just kept hammering me. Like, he wouldn't give me time to answer a question. He just kept asking questions. And I just stopped him and I said, you are an expert in women's health, but you don't want to listen to a woman about women's health. So if you're going to be a good doctor, you need to close your mouth and open your ears, because you have 1 of these and 2 of these. Yeah. And he shut right up. But I mean, I'll never work with him because he wouldn't talk to me. You know, he didn't want to hear what I had to say. And I think a huge problem is men are in control of women's health. And that's why they're not being heard, because they have a basic understanding. Well, not a basic, they have an understanding of the physical anatomy. And that is literally it.
Right.
So, yeah. So
right, exactly. No, yeah, I appreciate it. I mean, I understand it really. And I mean, just to state that, like, as a female doctor who's obviously gone through different hormonal situations in my own personal life, I mean, I'll just be open because it's the truth. I have suffered from fibroids. You know, I've had sciatica, you know, I've had issues that create, I've had, you know, bladder issues due to the fibroids, but also just after having 2 babies. I mean, nobody talks about how everything falls. So it's really important to keep that strength. And through chiropractic, through massage, through different therapeutic protocols that I have here at the clinic, and also getting treatment elsewhere out of my clinic, I have had such great relief and improvement with those conditions. So that's why there's hope. You know, there's things out there that you can do. I want to say this nutritionally, to bring it back into like, well, what, because a lot of women say, well, what can you give me? Because, you know, when you go to the medical doctor, it's all about medicine because that's what they practice, which is understandable. When you come to a clinic like my clinic, you know, what I'm suggesting and the help that I'm giving individuals have a lot to do with supplements. And one supplement that I want to bring up, it's actually a mineral. It's amazing. And it's a miracle mineral called magnesium.
I was just talking about this yesterday with a friend. Yeah.
Love it. And there's even a book that I was introduced to. It's a little book. It's called the magnesium, the miracle mineral magnesium. I think I might be botching what the name of the book is, but it is an amazing book. But the point is, all my years of chiropractic practice and the knowledge that I got with nutrition, magnesium is, besides also sulfur, by the way, is one of the main minerals depleted in our soils. Magnesium is a muscle relaxer naturally. So you take enough magnesium, it helps your colon, which is in that pelvic region. It helps with PMS. It can help with the cramping. It's relaxation. So, you know, people talk about taking it internally, which I suggest, but also Epsom salt baths are fantastic. Really soothing. Oh my gosh. After you've healed up with sutures, after having a baby or a C-section, taking Epsom salt baths, fantastic, right?
Don't you also need magnesium? Oh gosh, what is this? Don't you need magnesium to like process or absorb vitamin D?
You need magnesium.
Like that?
Yeah, it's calcium.
Calcium.
Yep. And so, and it plays a role with vitamin D. It plays a role with all vitamins actually, because at a cellular level, you need magnesium. It's kind of like a gate opener at a cellular wall. But it's really, really important for the absorption of calcium, which is a whole nother topic for women's health, right? Specifically speaking, when you talk about osteoporosis, that's like the hips, the pelvis. What are we afraid of? Hip fractures. That's that whole area as women, you know, as we get older. And nobody wants osteoporosis. That's, you know, so, but magnesium will help drive that calcium. That's why calcium now has magnesium in it. Like when you go to the grocery store or the health food stores or order online, you get calcium, it always normally has magnesium, vitamin D, vitamin K is another really important one. By the way, I'm really big on liquid and powdered product.
Okay.
For
Yep.
absorption. Yeah.
Yeah.
Because I feel like that's very important. People, they want it, and I get it. You go to the grocery store, or like, Costco's are really, like, I have people bring Costco brand all the time, which is fine. I get why they're doing that. It's affordable. Plus they've got a huge amount of product there and choices. But when you're taking tablets, that's very hard to digest.
Yeah.
You want this stuff instantly. So a powder or a liquid's better. Even if you get capsules, you can, magnesium doesn't really taste like anything but chalk. So, if you got calcium capsules, you could also open them.
Yeah. Throw them in your smoothie. You won't even know.
Yeah, exactly. And I like them at night because they are they are a natural muscle relaxant. So for pain, even if it's just pelvic pain, right? Magnesium is fantastic. So just one tip that I'll say nutritionally. I've got a lot of them. But
yeah, I know. We could probably talk for, another 2 days.
Right.
And I did also want to touch on the fact that in my energy practice, if we do not address things on an emotional and energetic level, they will manifest as physical problems. So if you have someone who is not able to voice themselves, they've been silenced either by environment, or maybe they're having to keep a deep secret. For some reason, they're not able to vocalize their truth. They will get thyroid problems. I see it all the time. And when we work with them energetically, we heal that emotional trauma, we release the throat chakra, and some of them have come off of medication. So there's a huge component there that we can't ignore.
Agreed, Amy. And what you do is so amazing. I have this emotional, it's not a pamphlet, it's a sheet, but it talks about the emotional components of areas that people have pain and subluxation with chiropractic.
Yeah.
I agree 100%. It's interesting in my field, we know that chemical, physical, and emotional stress really, really affects our bodies.
Yeah.
And if, you got to address all those components, right? Because that's how you become well. That's how you have optimum health.
Yeah.
Yeah.
Well, and I tell people, if you are just treating the body, you're never going to be healed. If you're treating the problem, you're never going to be healed. If you treat the whole person, then that issue will a lot of times go away, or at least improve a lot. So we can't just be thinking about physical things.
Correct. Agreed. And that's why I love the word holistic. Years ago, because I worked for a chiropractor before I even became a chiropractor, and, all he would talk about was the holistic approach, which really resonated with me and why it drove me into the type of practice I have today. It's really right. It's a holistic approach.
Yeah. Thank you so much for being here with us today. This was a lot of information, but I did just want to give you a chance again to share with everybody how they can contact you if they want to, and if you have any kind of like an offer, you can throw that out too.
Yeah, so we actually, right now, especially with the times, we are offering a online phone consultation, and it's both nutritional but also physical health. There's lots of tips that we can give you from home for the physical health, but we do a lot of nutrition here as well. So we have that offer, and it's $49, which is a great value. Right. You can contact me at my office at 714-730-2225. We also have a website. It's voitenkowellness.com. It's actually, my name is spelled Voitenko wellness.com. It's a long one, but fun to say, like Amy says.
Yeah, Voitenko. It's fun. It's a fun word to say.
Yes. And I'm very open to, being contacted. We have a Facebook page, Instagram page, Voitenko Wellness. So, if you guys have questions, you need help, I love to help people. I'm passionate about what I do. So, and thank you guys so much.
And you are on Pacific time.
Oh, yes, I'm in California.
Yes,
correct.
She's in California. So, yes. And I'm in Wisconsin. So there's where the time difference when you want to contact.
That's right.
Thank you so much for being here with us today and giving us all of this information. I really appreciate your time and, just your work in helping women.
Oh, you too, Amy. Thank you for having me. And I thank you for all you do too. You're a very neat lady, special lady.
Oh,
Thank you.
thank you so much.